The title for today's webinar seems appropriate for healthcare reform. It's sort of like a child viewing a Christmas present, wrapped up in a pretty bow. And as we unwrap this present, which with healthcare reform, as you know, is over 2,500 pages, what we found isn't always what we expected to find. I will put a little disclaimer to start that the regulations are constantly changing, that there are interim rules and there are transition rules. So even what we go over today may change and probably will change in the future. The beginnings, as we know, for the healthcare reform, it was passed into law on March 23rd, and the rollout of the provisions are going to be based on that initial day that it was signed into law. Now, it's real interesting to note that the IRS actually estimated that they would be hiring over 16,000 additional agents for auditing and enforcement purposes.
Well, that's certainly going to help our economy, isn't it?
Yeah, you can say that again. What we're going to do today is do a chronological review of the healthcare reform, and I want to start off by looking at two provisions that actually were effective retroactively to January 1st. The first one I think is going to be a tremendous value to small businesses, and starting this year, and this will go retroactive to January, businesses with fewer than 25 employees and average wages of less than $50,000 will be eligible for credits. Now, the maximum credit will go to those employing fewer than 11 workers earning an average wage of less than $25,000.
So, Dave, when we talk about small businesses, we're talking about less than 25 employees?
That is correct. And if they are up to 10 employees and the wages would be less than $25,000, then they would qualify for 100% of the credit, which is 35% this year through 2013. In 2014, that credit is actually going to be increased to 50%.
So tell me about the difference between a credit and a deduction.
Okay. Currently, employers can deduct the premiums that they pay for their employee benefits. The credit is much more valuable because it is taken off of the amount that is actually due in taxes.
Okay.
But it is important to note that the credit that is received would be offset by the deduction dollar for dollar. So you're not going to get a deduction and also the credit. It's just one or the other. But a credit's much more valuable.
Okay.
The employer is required to pay at least 50% of the single portion of the premium in order to qualify for this credit. But the intent is that employers that have struggled to provide benefits for their employees, especially we're talking small groups, will receive this incentive to help them in order to afford to continue providing or maybe start providing benefits that they had not previously.
Okay. Well, that's some good news.
That is some good news. The next provision that is retroactive to January is an increased adoption credit. And I just kind of threw this in because I've been to a lot of webinars and I've seen a lot of presentations on healthcare reform. And Gina, I've never seen this really addressed before. It's kind of odd to be thrown into the healthcare reform.
Well, that's what I thought, because when I first saw this and I'm going adoption credits, it's like, how does that fit into healthcare? So shed some light for me, if you will.
I'm not real sure exactly how it fits in, but we know that it is law and that it is an additional benefit. And you as an employer may have employees out there that are adopting this year. They're going to be eligible for an additional $1,000 of assistance. So the new credit is going to be $13,170 for 2010. Another change that occurred with this is that the credit is refundable this year, which makes a difference. If, for example, a tax person is filing their taxes, does not owe any taxes, they still would be eligible to receive this adoption credit because it's refundable.
Okay, so normally the credit is what, 12, or the credit you get for children is 12,500?
It's over 12,000, and it's
Right.
going to 13,000 this year.
Okay, so this is for people that have adopted during 2010,
Correct.
that they can take this additional credit on their 2010 taxes that will be filed in 2011.
Exactly right.
Okay.
And just something that you may want to pass on to your employees who you may have knowledge that they're in this particular situation.
Okay.
Now we're going to move on to part of the regulations that took effect June 23rd and after. The first one is for young retirees. There are some companies that provide benefits to employees who have retired between the age of 55 and 65, and this provision gives a refund of claims that would be paid between $15,000 and $90,000 on an individual employee basis to those retirees. Now, there is a stipulation that any amount of money that is included in this refund has to be paid or has to be used for cost-saving programs for those same early retirees.
Okay, so let me see if I understand you right. So a company that has employees that have retired between, what did you say, 55 and 60?
55.
55.
Yes.
That if they are providing retiree health care coverage, then that company can get a reimbursement based on claims.
Correct, and they would be eligible for reimbursement at 80% of the claims that were actually paid out between $15,000 and $90,000. So we're talking about some chronic medical conditions. In fact, the application for this credit does specifically state that the medical conditions are chronic, and the medical carriers have to provide services like case management for these chronic conditions in order to be eligible for the credit. But I want to refer you to the website that's on your screen for more information.
Now, why would the company get the reimbursement and not the individual who's been sick?
Because the company is providing this benefit, and they're wanting to reduce the cost to those early retirees, and that's why the provision requires that any credits be specifically used to reduce costs for the early retirees.
So this might then provide an option for companies that want to provide health care to their retirees to look at, because it might help them to be able to afford to do that.
That's true, but you got to keep in mind, in order to qualify for the credit, there's got to be some really substantial claims involved, or else there's no credit available.
Okay. So it's got to hit that 15,000 milestone marker before the claims kick in, or before the credit kicks in?
That's exactly right.
And is that aggregate for the plan, or is that for an individual that's covered?
That's on an individual basis.
Okay.
Right. The next area I wanted to address, back to June 23rd, is the creation of a high-risk pool. The state of Florida has had a high-risk pool for many years. Unfortunately, it was closed to new applicants, gosh, probably at least 15 years ago. The state had an option of either creating a new fund for this or using a federal high-risk pool. And there were dollars coming down from the federal government for this, but they were only for a short period of time. So the state of Florida opted to use the federal high-risk pool. And this is a way for people that are uninsurable to be able to get coverage that previously did not have access.